welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk with medical students who are interested in ophthalmology, residents training in ophthalmology, and current ophthalmologists in the field today. I'm joined by two guests today, Dr. Audina Berrocal. She's the director of the Pediatric Retina Service at the Bascom Palmer Eye Institute, also a professor of clinical ophthalmology at the Bascom Palmer Eye Institute. My second guest is Dr. Tom Albini. Dr. Albini is the co-director of the Vitreoretinal Surgery Fellowship and also a professor of clinical ophthalmology at the Bascom Palmer Eye Institute. Thank you both so much for joining me. This is a huge honor. Your friends have been on the show, Dr. Luck and Paul, Dr. Kitchens. So, just by proxy, I think we'll have a fun time.
Thanks for having us.
Dr. Berrocal, let's start with you. I like to ask most of my guests their origin story, what got them into ophthalmology, what got them into their specific subspecialty. Your subspecialty is more pediatric retina, and I know a lot of your family members have been in retina. Your father, your sister, interestingly, your nephew Luis and I had a recording last weekend, so that'll be a fun episode to put out there. So I think there's this sort of tendency. We talked about this a little before we got on here, but people assume sometimes when you have family in medicine that's probably why you want to do medicine, and there's that external sort of expectation. But sometimes we all go about our different ways of finding what we want to do. I know that you have an interesting background, what you majored in college. So tell us your story about how you got here and what drew you initially to ophthalmology.
Thank you for having me, but great questions. And I'm the third child of three. I had an older brother who was a lawyer, so he escaped the medicine, but it was a hard path to tell my father that he wasn't going to be a doctor. Then you have my sister, who became an ophthalmologist and a retina specialist. And then there was me. So I went from Puerto Rico to Princeton. And at Princeton, I looked at majoring in everything else but medicine. I thought about architecture. I actually liked it. I thought about lots of different things, just being a professor in Spanish literature. And then ultimately, I ended up majoring in political science with a minor in Latin American studies. And then from there, I worked in Congress one summer thinking that I wanted to be in politics and all that stuff. So, I fought it. I thought that, why should I be a doctor? Everybody in my family is a doctor. We only talk about medicine at the dinner table, one of those horrible, boring things. So, at some point, I graduated from Princeton, tried to get a job as a paralegal. Mm-hmm. And I used to babysit for this guy across the street from me who has a law firm in Puerto Rico. So I called him up and I said, would you give me a job as a paralegal? And he said, well, come and interview with me. So I interview, and he goes, so great to see you, ta-da-da. And he's like, Nina, I love you too much to give you a job. And I'm like, what? I mean, really? I mean, who says that thing? I just give me a job. I need a job. And he goes, when I look at your dad and I see that your dad is his own boss, he has his own practice, he does something that he makes him feel good every day, I think you should think about medicine. So, here I am, I go back at it, and I said, well, maybe he's right, maybe I'm just fighting this, and this is really what I should do. So I went back, I worked in a lab in Boston at the Mass Eye. I did a year of P53 bench research where I did looking at P53 between skin melanoma and ocular melanoma, and it happened to be that my mentor at the time was Shiz Mukai, who does pediatric retina. Go figure. Mm-hmm. So after that, I ended up applying to med school. I stayed in Boston, went to Tufts, and at some point, I thought, let me do something else. I'm not going to do retina. My dad does retina. My sister does retina. I mean, really. And I really like kids, and I've always loved kids. My dad thought that I should have been a pediatrician. When I was little, he would say, you should be a pediatrician. You should work with kids. And I was rotating in my PD rotation at Tufts with Craig McEwen, who's now at Bascom Palmer. He's a pediatric ophthalmologist. And he's like, Nina, you really like kids. You should think about pediatric ophthalmology. And I said, I really like kids. I really like retina. I mean, I really like retina, but muscle surgery, I can't spend my life doing muscle surgery, and kids in clinic with the screaming and the look here, look there. I don't have that kind of patience in me. So he said, well, why don't you do pediatric retina? And at the time, there was only Tatsuo Hiroshi in Boston and Mike Tracy in Detroit who really did it, at a big level. So, I said, I'm just going to do retina. So I applied to retina. I ended up at Bascom Palmer. And at Bascom Palmer, the person who had been doing ROP had left. And there was a void. The chief residents were taking care of the service. So they say, Nina, it seems that you like kids. Do you want to stay and do ROP? And I'm like, oh my God, this is like my dream come true. Are you kidding? So, everybody has a story. I'll tell you, I think the more you fight something in life, the harder it is, but it always finds you. I believe that things will always work the way they're supposed to.
Yeah. And I think it's interesting because, I think it's sometimes important to have that fight and sometimes to question, what do I need to do? What fulfills me? And then you find your own path along the way. And it's interesting. I talked to Dr. Chan, who had a similar sort of interesting background with, there was an opening for somebody to take up, pediatric retina. And he said, okay, I guess I'll do it. And then it happened. So, the saying yes to opportunity sometimes can just turn into a career. So it's very interesting. Dr. Albini, let's get to you. I mean, I know that you had a very interesting story as well. You were in college, you were thinking about theoretical physics, and then you thought about history, getting a PhD in history, and you've always liked science. And I know your father is a surgeon, but also, research immunologist. So talk about what got you into medicine, what got you into ophthalmology.
That's circuitous route too. I think much like Nina, I thought I was going to avoid medicine initially. And so when I started college, I was really interested in theoretical physics of all things, and really without much of a concrete plan as to what I was going to do with that. I'm not sure that I really didn't know, but I just knew that I liked the subject material and I liked studying it. And then, I started realizing that other things were coming easier to me when I was in college, and I actually did a lot of stuff in the history department. History wound up being my major, and within history I wound up gravitating to history of medicine, and that's a topic that my dad was interested in, and I had had some exposure from him, and I really liked the professor that was there at Princeton at the time in that history of medicine division. So that was how I got into it. But at one point I decided that I wasn't going to go into either straight PhD history or physics or other science, and that I really wanted to do applied science and do medicine. And my dad probably had a big push there. I mean, I remember his line was always, in medicine you can do good and do well at the same time. That was, he must have told me that many times. So that was I think a part of the drive. My mom was also just kind of at a practical level. She was like, oh, you should do what your dad did. And I come from not only my father, actually I trace doctors back many generations back in the family. So we've had a lot of doctors, much like you were saying, there's a lot of talk about medicine at the dinner table. And in my family, there was a lot of talk about basic immunology at the dinner table too, because my dad was a research immunologist. And when I did wind up starting off in medical school, originally, I thought I wanted to do orthopedic surgery. I met and heard a lecture from an orthopedic surgeon who specialized in surgery for ballerinas who had these very unusual set of joint problems in their ankles. This guy lived in New York City, and he operated and took care of the New York ballet, and he had people flying in from all over the place. And I thought that was very cool. And in college, I spent a lot of time as a very unprofessional musician, playing drums in a bunch of local bands, and that really took up. So I thought it would be cool if I did hand surgery, and that was where I was going. And that was really my career path until I rotated through general surgery and then realized that wasn't quite my personality type. And just by pure luck, I was doing research in a lab that was an immunology lab, again, and that was kind of a path that came forward from my dad's interest. And the woman that I was working with had decided to drop out of general surgery and go into ophthalmology. And there was a cornea specialist that was doing research there at the corneal transplantation research. between the two of them, all of our lunches were talking about ophthalmology and how much better it was than general surgery. And I said, okay, well, I got to at least try it. So I did one rotation and then another rotation. And, you know, I had wound up spending, I think, something like a total of 3 to 4 months rotating through ophthalmology as a third-year medical student, which you could do at Hopkins. It was great. So after that, I knew that I was headed in that direction. And then during residency, you know, I also actually, funny, you know, don't think about this much, but there was a period where when I rotated through pediatric ophthalmology, I really loved it. I was at USC. Right. And at LA County Children's, which is their pediatric ophthalmology, they have a fantastic unit of subspecialists in pediatric ophthalmology, including retina and neuro-ophthalmology. And Mark Borchert was the head of the program there. He's a pediatric neuro-ophthalmologist. Okay. And he's one of the brightest guys you'll ever meet. Amazing person. And I really thought about it. I love the kids. I love the way that your clinic is totally different in pediatric ophthalmology because you're making faces and noises and trying to engage the kids. Yeah. Something, you know, you can't really get away with the adults. So that was, you know, I did think about it for a while, but then I really loved so many things about retina, the surgery. I had a problem, strabismus, like, horizontal strabismus, I could figure out. That was pretty easy. But once you got into vertical deviations, I was just my head. I just couldn't conceptualize what was happening with the surgery. Sure. And then there was just the call of retina surgery, and I just felt it. I knew that I was going in that direction. And the combination for me with the immunology and the retina surgery was uveitis. Yeah. Yeah. So that was my that's how I got here.
It's funny because I think those things in retrospect, right? I think it's interesting to think about how different ingredients kind of make the person. And even though you didn't pursue history or you didn't really pursue, you know, theoretical physics or, you know, it all plays into some part of you or some different skill set or something it taps into. You take those experiences with you. I believe. I don't think any, you know, experience is wasted or anything like that. So it's just interesting to think about those things in hindsight. So, you know, again, this show is meant for the medical student audience. You're both in academics at Bascom Palmer, you know, and some of my other guests, such as Dr. Kitchens or Dr. Luckenpaul, your friends, they're in the private sector of, you know, of medicine and retina. So talk about how, you know, for, you know, Dr. Berrocal, we'll start with you, how academics has called to you and what you really enjoy about academics and what really makes a good academic career last.
Well, I'll start by a disclaimer that I never thought I was going to be in academic medicine. I always saw myself as going back to Puerto Rico and practicing, you know, in my dad's practice with my sister and just having a life. You know, and my dad, you know, growing up, my dad had always been part of the university and he had been in private practice. So in Puerto Rico, it was easy to do both. You could do, you know, work at the university for a couple of days, even at the VA, and then you would do your private practice. So I thought something like that would be great. My dad was always involved with teaching residents, and residents were at my house and you know, all that stuff. So, you know, when I ended up at Bascom deciding to do pediatric retina and getting hired to do pediatric retina, you know, I realized that one of the things that I really like are weird things. You know, I'm into weirdomas. You know, the weirder the thing, the most interesting it is to me. So, you know, I think academic medicine is a place that I can actually practice pediatric retina and have a really full pediatric retina practice that I have developed throughout time. It didn't start with, you know, all kids. It started doing everything. You know, I still do everything because, you know, it's fine. It's good to do adult retina. It makes me feel like, oh my God, a rheumatologist detachment is so easy compared to what I do on a daily basis. So that combination for me makes me happy. I love teaching. I like teaching surgical retina, and I also attend cataracts with the residents on Fridays. Yesterday I spent a day with one of my residents. It keeps me interested. It keeps me, it's nice to help somebody grow surgically. I had some really good mentors that allowed me to be the surgeon I am today, and I think to be able to give that back is great. And honestly, being surrounded by young people all the time, it keeps you alive and interested. There's always something going on. There's always something interesting. People come to my clinic. Listen, I saw this. What do you think? So, at some point in my career, I thought about going to private practice. Like everybody does. You're either in academics thinking about going to private practice, or you're in private practice thinking, should I have done academics? I experienced that. I thought about it, and I realized that if I have to go to a private practice and just do epiretinal membranes, macular holes, and rhegmatogenous detachment and macular degeneration after I've been doing what I've been doing, I think I would not necessarily be happy. So for me, it just keeps me alive, interested. I love seeing Tom. I have Tom next door. I go and talk to Tom. I have residents. It keeps you interested. Every day makes me happy to go to work.
Sure. Yeah. So Dr. Berrocal, I think it's interesting to think about, how we can sometimes assume we're going to end up somewhere and then we end up somewhere totally different. I think I'm pretty early in my career right now, but I think, I can tell you from my own experiences in college or in medical school, we come in with a plan and then the plan gets laughed at and then we just end up doing something totally different. So, as long as I feel like what you talk about is important because it's something that you're passionate about now. You've been at Bascom Palmer for years now, and it's definitely somewhere you feel comfortable and happy, and that's the most important thing. So, Dr. Albini, what about you? What's your perspective about academics versus private practice, and what makes you, geared towards academics, and what you really like about it?
Well, again, going back to Dad, I don't know why I keep, going back to him. He was an academician, 100% researcher. Really gave up his entire surgical practice just to do research. I'm not all the way there, but I saw how much he loved the academic environment. Going to meetings with him. I remember he took me to Japan once when I was in junior high school, and he gave little talks at a number of different universities in Japan. And so we got a whole tour of the country and those kind of experiences and seeing the great meaning that he got out of making contributions to the knowledge base that we had about immunology, how much that meant to him. And mentoring, he always had postdocs in his lab, and you would, in basic science immunology, those folks you would see them at home, you'd have parties with them, they'd be over, and the postdocs sometimes lasted for years. So you got to know those people pretty well, even as the son of the doc. So that academic environment really drew me. And so I kind of knew that I was going to wind up in an academic sphere. Mm-hmm. On the flip side of that, things that didn't interest me that much, as I started visiting, when I was a resident, I went and I visited a very successful cataract practice in Los Angeles. And I was thinking about, well, maybe I won't do any fellowship. Maybe I'll just go into cataract surgery because I liked cataract surgery. And so I thought about that. Mm-hmm. And what I didn't like about it is that it had this kind of I don't want to play that down because I have a lot of respect for that. But to me at the time, it looked like it was just like a factory. Mm-hmm. It was incredibly efficient. This guy was doing like 30, 40 cases in a day, and he was turning around. But the way that it all went, every case was exactly the same. He would rush out, take a picture with the patient. I think he'd give the women a rose. I forget what he did. There was a whole PR kind of side to it that to me was less appealing. And then when I started looking at retina practices, sometimes I would go to these interviews at private practices, and they'd be talking about the inventory, the revenue stream from a parking lot, or different types of real estate deals, and buying a property, leasing it back to yourself, and what the tax benefits of that were. And while that stuff I think is incredibly interesting, and I have a tremendous amount of respect for people who build their own business, sure. That was less appealing to me than talking about the science, mentoring young physicians that were coming into the field, and talking about what were actually the clinical enterprise. And so that to me was the difference. I thought, the folks at the university were really talking about the things I wanted to talk about. And of course, you know, there's the politics at universities, and there's a lot of red tape and bureaucracy, and you know, that's true. That's the downside. But to me, the upside was greater than the downside, and so that's how I wound up going there. There's no doubt, just to be realistic about it, that, you know, it's a huge opportunity cost in terms of revenue. You know, I mean, you're going to do in Retina right now, thank God, you're still going to do much better in private practice than you are at academic centers. So it comes at a huge cost. And these were conversations that I had with my spouse about, you know, how we were going to do this. But there was never any doubt in my heart that I really wanted to go into academics.
Sure, sure. And that ties me into something I want to talk to both of you about was, you know, was purpose, and how you find purpose in your life and purpose in your, you know, and a big part of each of our lives, hopefully, is our career, or something we spend so much time doing and pursuing. And, you know, unfortunately last night, Chadwick Boseman, the actor who played, you know, in Black Panther, and Jackie Robinson, 42, he's, you know, world famous actor. He passed away tragically from colon cancer. And I saw this quote, and I actually thought it'd be a great thing to bring up. And the quote is, "You would rather find purpose than a job or career. Purpose crosses disciplines. Purpose is an essential element of you. It is the reason you are on the planet at this particular time in history. Your very existence is wrapped up in the things that you are here to fulfill. Whatever you choose for your career path, remember your struggles along the way are only meant to shape you for your purpose." So, you know, I think about that, and as somebody who's applying for residency, and, you know, there's the whole stress about, oh, what if this place doesn't reach out to me? What if this place doesn't like me? And then, you know, you can get into that trap of like, well, what is the purpose? Why did I do this in the first place? Why am I doing this? Why am I here? And, you know, I just wanted to get your perspectives. You know, Dr. Berrocal, we'll start with you about how, when you look back at when you were, you know, you were in my shoes, when you were applying for residency, when you were going through this process, how you carried the, you know, your purpose through into the rest of your career, how your purpose has maybe changed with regards to your career, and how that's inspired you.
Wow, that's such a
Super deep question.
wow. I think you know, I think, you know, when I was young and I was thinking of going into politics, it's the same reason to go into medicine, is to do good for the majority of the people. And I think, you know, in medicine you do it. I mean, not everybody, but some of us do it because we want somebody's life to be better. So in my mind, in ophthalmology and in pediatric retina, I think in pediatric retina there was a big empty space of people who really wanted to dedicate their careers to kids. And if you see retina specialists in general, it's easier to take care of an adult than it is to take care of the kid. You know, it requires that you have to sit with the parents. It requires that my phone is on all the time. I get texts during the weekend. The eye looks like this. What do you think? You know, most of the counseling that I do with the parents. You know, the kids are easy compared to the parents. So, you know, it requires going to the OR, having, you know, exams under anesthesia galore that takes up all your day, while I have my colleagues who can do 10 ERMs in, like, you know, half of the time that I've been working. So, you know, at some point, you know, you make a decision that you want to do something that has some meaning to you. And I think ROP, that's the way I think about ROP. ROP is, you know, every week of my life for the last 20 years that I've been at Bascom Palmer, I've been going to the NICU once, twice, 3 times. But, you know, I don't have any blind children from ROP, which is, you know, it's a testament to the dedication of going there all the time and trying to get better at something that's very hard. So I think, you know, I think I found a way to feel that my life had purpose in what I'm doing every day. But, you know, in that you add being a mother, you know, being a wife, you know, being a friend, a daughter. So, you know, there's purpose in all that. It's just, you know, that at times it's going to be ROP more important than what's happening at home, and at times it's going to be what's happening at home more important than what's happening at work. So, you know, it's all a balance, and always having your priorities straight.
Dr. Albini, I'll ask you the question, the same one now, about purpose. And you know, we talk about life-work balance and trying to, you know, keep work at work, or keep your home life at home life. But at the same time, if you feel like what you do in your career is something you're passionate about and something you have to make sacrifices for, what is your takeaway from purpose, and how it instills some of your philosophy with what you do every day?
Yeah, I like that quote that you read tremendously. I think that's right. That's the way, that I think about these things, and I agree with everything that Nina said. I think that we're very fortunate in medicine to have a career where it's very easy to see your purpose, because I see my purpose, 50, maybe too many times each day, more times than I would want. But with each patient, you feel like you're having an impact on that patient's life.
Right.
And I think it's very important, because I think it's certainly possible with burnout and just getting jaded over the years, to lose sight of that. I think you can become very good at what you're doing, but not really appreciate the purpose of it. And so I think that one of the best maladies for burnout, or best prophylaxis for burnout, is to be grateful for the purpose that you have. And this sounds, very kind of pie in the sky stuff, but I think it's very true. I do love that relationship with fellows. I think you have to, through training, one story while Nina was talking and you were talking, one story that came back to me was when I was a med student rotating through one of the rotations. I saw a resident who really got beat up horribly, and it wasn't for anything that bad. But I went to Hopkins Med School. There was a culture of being pretty strong, as they put it, or harsh sometimes with each other. So this guy got beat up big time, and and it was inappropriate, really. It wasn't for anything that he had done wrong, and so I talked to him about it, and I said, how do you keep a smile on your face and go forward when you've been treated like this? I mean, totally mistreated, actually. And he said, look, I just know why I'm here. I want to learn how to help patients, and that's what I'm getting out of this. The rest of it is just kind of whatever. I'm not going to let myself get bogged down by the politics of situations, or the way that somebody makes me feel, or the way that that somebody treats me. So at the end of the day, I'm learning how to take care of patients, and that's the central theme. I always thought that's very important to keep that in your mind, because our careers, certainly, Nina and I can testify to that. There's so many different components of what's going on with what we're doing on the teaching side, heading up a fellowship program, being involved in many professional societies, and all that comes with that, working with industry. There's so many different levels to what's going on. But I think at the end of the day, to really keep that purpose, you have to remind yourself that you're there to take care of the patient. Because even talking about life-work balance, even I've known that people make sacrifices for research, where they're so focused on their research initiatives, and that's very noble, fantastic, that might help thousands of patients. But then because of that, they're neglecting maybe some of their responsibility to Mrs. Jones.
Yeah.
And so I think you just have to be aware of the decisions that you're making, because one thing that I think, I'm sure Nina will agree, you can't do everything. So at some point, you have to, as much as you might want to do everything, you have to make a decision. I'm not going to try to apply for an R01 grant, or I am, but if I do that, I know that I'm not going to be able to do, maybe be program director, or do as many cases, or see as many patients. So I think a lot of us really love what we do, but you have to be able to come up with some rational equation for yourself as to what things you're willing to give up to do the other things that you love to do. And very few people don't want to have a family, and don't want to have a private life. Now, there are some people that may make that decision. They're just like, I don't have time for it. And I have nothing against that decision. That's a type of balance, and I always feel like the term of work-life balance makes it sound like there's some secret balance, some secret amount, but that it really depends on the person, where you are, and not only the person, but also what part of your life you're at. You may be early on in your career, you may be all about the R01 grant, but then you may be more about your kids later on in the career. So I think, you know, you have to make those decisions of what you want to do and how much you can really do well all at the same time. And it's just important to be cognizant of it. And I think if you're not thinking about it and you just kind of move on and see what happens and say yes to everything or whatever, then you get that's when you get burned out, because you can't succeed at everything. You have to say no to something.
Yeah, no, it's a good point. I think that's the point a lot of us med students need to keep in mind, because we're at this stage of our careers where, you know, we should be saying, I guess one way I see or what I've been told is that you should say yes to most things right now. This is the growth part of your career. You know, when you get more established, maybe, okay, then you can make up your mind about things. But for now, you know, but I think it's important to think about that. And I think you both touched on really important aspects of what makes you feel fulfilled every day. There's not, every day is not going to have the most easy challenge, saying, yes, this is what I'm supposed to do. I'm sure there's challenges along the way with your patients and whatnot, with the administrative, you know, responsibilities. But, you know, that's interesting to take away from that. So I want to segue into a topic here that you both are very passionate about. Let's talk about VBS. I mean, VBS is something that you both are actively involved in. Dr. Luckenpaul has described, Dr. Berrocal, he's described you as a thought leader when it comes to the themes of the events and the costumes. And Dr. Albini, I know that you were one of the founders for VBS. So you know, why is VBS important to you? Dr. Berrocal, I'll start with you. Why is VBS important to you? And then also branching off from there, you know, we're in a year where we're talking a lot about different social events and different, you know, different sort of issues in the world today from a work standpoint, social standpoint, political standpoint. And gender disparities is one of those, was one of the things that we're starting to really pay more attention to. And I know that you were participating in Women in Ophthalmology last weekend. So talk about how, you know, being a woman in medicine and being part of VBS, how that's been important to you and what you take away from the society.
Wow, so what can I say about VBS? But like, honestly, the greatest thing that has happened in Retina in the last 20 years has been VBS, and the greatest thing that has happened to all of us as a—
It's a fact. You can look that up.
I took
I have to tell you that I love how I still remember to this day when I get a phone call from Tom, and he goes, listen, I wanted to ask you something, and feel free to say no, you know, it's okay, you know, da-da-da. And I go, okay, go for it. So he says, you know, it's a group of us, we're like 5 that came up with this crazy idea of having a meeting for young people, surgical, da-da-da. And he said, do you want to be part of it? And I'm like, yes. And he's like, yes, that's it? And I'm like, yeah, sounds great. I mean, what the hell? So honestly, from that moment and from the first meeting that we all went together to start thinking about this to where we are today has been an amazing trip. I mean, it's been a journey, really. And for me, as a female retina specialist within these guys, you know, has been great because they are open-minded. They are willing to listen to crazy ideas. You know, I'm, you know, outside the box. And when it came to gender, I think, you know, I kept pushing things on them. I said, let's just think about this, or let's do it this way, or what about this? And never once have I heard a no. It's always like, I don't see why that's important. Tell me more about it. And then we have an argument, but it's like the perfect thing. It's like the group of friends who push each other to be better at everything we do, and yet intellectual, respecting each other, and honestly, we just have fun. And I don't think that anybody who has been to VBS can say that all that is not evident in our every meeting that we do. And I think that's a testament to who we are and the group of people who really started this.
Yeah, and I'll tell you, I really love you know, this is the silver lining of this year where we're in a position where now a lot of things are online, is as a medical student to attend VBS online was really interesting to watch. How going into it, I was like, oh, this must be a very serious educational event, which it is, but it's also so fun. I mean, the way everybody's dressed up in costume and everybody's really invested in the costumes and everybody's really, you know, 110% involved. It seems like, there's a passion there that's very, it's tangible, you can see.
And I have to tell you even more. I think that the one thing we don't talk about enough is, we work very hard, all of us, right? Every day we see, 60 patients, 50 patients, and you have to make a decision every couple of minutes, right? An important decision on every patient. It might be the right decision, it might be the wrong decision. You're in surgery, they're tough cases. Sometimes it works, sometimes it doesn't work. And we never talk about the emotional toll that our lives really have on a daily basis. I mean, we never do. And we get home at the end of the day, and then you have to deal with other things. So I think that VBS is a way to do what we do and do it extremely well and extremely serious what we talk about. But at the same time, have a moment where you can let it all go and just have fun and be with each other without having to be at a cocktail party talking about the latest technology. I mean, you're just having fun, and I think that makes it even so much better.
Dr. Albini, I'll ask you now. I mean, you were one of the founders of VBS, and you were at the initial meeting that I heard was in a bar when the idea came about. So, tell us about how
Back of a napkin in a bar, classic story.
Joke, right? It's like a bad joke. So, and it turned out to create such a fun initiative and something that you're really passionate about. So, talk about what VBS has meant to you and where you see it going forward, and the initiatives that Dr. Berrocal touched on in terms of wellness and gender disparities and why those things are important to address right now.
I love listening to Nina talk about it. It has been an amazing journey. I think that's right. And I'll tell you one interesting thing about it is that if for those of you that have ideas that you're very passionate about, but you think this isn't going to go anywhere, sometimes it's right to do it because because this was definitely in that category. This was like a crazy thing that, that really, there were so many retina meetings already. So the fact that we would add another retina meeting, because retina, for those that are listening that don't know, our particular subspecialty in medicine, I think has more professional organizations. We've got the American Society of Retina Specialists, Macula Society, Retina Society. There's a couple of European societies that many Americans belong to. So there's already multiple groups that are involved. Why do we need yet another one? And the concept was simple. I mean, at the time, there wasn't a lot of, at the meetings were dominated by medical retina, by the new big pharmaceutical products that were coming in. And there were a bunch of us that said, hey, we would really like to talk about surgery. Now, that wasn't the total novel idea. There were other groups that were doing that at the time and previously, but we wanted to do it with videos of surgery. That was the original kernel concept. And how it got from that to what you saw online last week is just the product of 10 minds making the best out of the situation and going forward. I never would have, honestly, I don't think I ever would have winded up on my own accord saying, hey, we should do a meeting, but we should all dress up as our favorite, superheroes like that. That is not, but it's been proposed. Nina's, as I think Paul said, Nina's been a big proponent in that. And I remember the first time, one of the meetings that we had, Nina said, hey, we should do a toga party. It was the meeting was being hosted at Caesar's Palace. And I'm kind of a naturally conservative person. I was like, toga party, that sounds like a frat thing. I was like, these are serious people. We're going to have them dressed up. And I was literally just like Nina said, I was skeptical, but I was like, well, what's the worst that can happen? It'll be a bad evening. I mean, let's try it. Let's see what happens. Nina went, she bought togas for all like these, like Steve Charles, the guy who basically invented, modern vitrectomy. These like huge giants in our field that are in their 60s and 70s. They were in togas at our at our meeting. And I don't know if Steve Charles particularly was, but Don D'Amico was, for example. Other sort of very, very so it worked, and I think it was that party that launched where everybody was like, you know what? It's really fun to have a costume party at an academic meeting. Yeah. And I don't know, maybe the viewers can tell me. I don't know if there's any other professional society in medicine that does that.
So
But it worked, and there was no downside to it. It was a lot of fun, and I was won over on the concept, and then we did a few more, and then when COVID hit and we had to rethink our meetings, there were a number of very interesting things, and that is that the thing that's been so great on a personal level about VBS to me, and I think to Nina too, is that this particular group of 10 people that now we've been working with each other on this for whatever many years, over 10 years, I think we all get along very well, and that's important. And we all respect each other, and we've never had any real sort of big fights within the group. We all kind of see eye to eye. We have our differences, there's no doubt about it, and sometimes we even yell at each other and whatever. But for the most part, it's always comes from a place of respect and admiration, and just trying to do the best that we can for the group. So I think that what we were trying to see is how do we keep this group young and innovative. And we noticed that a lot of us were moving into a position in our careers where we might want to devote time to other things. I mean, and so and also we had to admit that now as 50-year-olds, are we really still the young man's Retina Society? Because how long are we going to try to get away with this till we're like 80? So anyway, so we came up with a plan where we were involving more and more people that are younger than us, and it's been a great way for mentorship. It's been a great way to help the folks that are with us have such incredible perspective. I mean, you mentioned Jay Shridhar, you know him, Mrinali Gupta and Yoshi and Royce Chen from Columbia. I mean, so many of these just great minds. And by virtue of what we've done already over the last decade, now we have some resources that we can share with them and some advice that we can give them, and that they can move forward with these things. And the COVID situation was perfect for it because it was a whole new thing.
Yep.
The 10 of us could have done it, and we would have done something. I don't know how it would have been. My guess is it would not have been as good or as successful as what we came up with, mostly because we just turned the reins over to the younger group. And so they went with it, and then they came up with what you saw. And I still think it's great at a clinical level, on a academic level, and it's fun even if it's on Zoom.
Yeah.
Certainly not as much fun as an in-person meeting, but it's close to that. So, it's been interesting going from a closed group of 10 people that get along really well and have success at doing something to turning it into something that hopefully will stand on its own with different groups of people rotating through it as time goes forward.
Yeah, and I think the spirit of what you initially from that first meeting, the spirit of the friendship aspect of it, how a group of friends say, hey, let's just do this together and let's take a risk. I think that speaks a lot to why I like to talk about and learn about it, because for me as a medical student and for others who are out there, we're at the stage of we're trying to meet other people on our level. I'm trying to meet other applicants through this initiative. We're trying to understand who's out there, who probably are future colleagues and stuff like that. So to seeing these kind of initiatives form, and then for them to be sustainable and to only grow, and for them to have like a purpose where they can actually be informative and fun, and to have that camaraderie in them, it's really exciting to see, because I think we look to that and we're like, well, what's down the road for us? What can we be a part of? What can we contribute to? And I think that's exciting to see how these initiatives grow, and what they can really mean to your careers and the friendships you form, which is just so imperative. And I think it's really exciting to see how passionate all of you are when I bring up VBS, and it's palpable, and it seems like it's just such a good time. So looking forward to seeing how that continues to grow and evolve, and what the next in-person meeting will be. Hopefully it'll be a good one, and it'll make up for all the time lost. But I think for the meantime, you guys are doing a great job. So a lot of people are going to ask me if I don't ask you guys about Bascom Palmer. I mean, to have two people as faculty who are professors of ophthalmology at Bascom Palmer on my show is, number one, something I would have never imagined 6 months ago. Actually, 6 months ago, I wouldn't have imagined to have a show. So that's one thing, but that's totally different. But so let's talk about Bascom Palmer. I mean, you stayed there, you're happy there, Dr. Berrocal. I mean, from a, think back to your days of when you trained there as a fellow to what you're doing now and teaching fellows and doing things in terms of, being the first person at Bascom Palmer to, inject Luxturna into a patient and stuff like that. And, what's the culture of Bascom Palmer for somebody like me, who's from Kentucky, who just knows it by name, who's never been there? What's it like to be down at Bascom Palmer? What are you all looking for with your trainees, and what's the whole, what's the culture and mission at Bascom Palmer?
Well, I have to say that, I think, and this sounds like Dorothy, but there's no place like home, there's no place like Bascom. And I do firmly believe that. I did residency at Tufts in Boston, so I was exposed to other programs. I had been at Massa and Ear before that as a researcher. So, I have seen other programs. I came to Bascom as a fellow, and then I stayed. And, I will tell you that there is a culture, there's something about Bascom that's different, intrinsically different. And I believe that it is a sense of family among the people who train there, the residents, the fellows, the attendings. One thing that helps is that it's the only real program in Miami. It's been here forever, and there's no competition. It's not like Boston. You have Leahy, you have BU, you have Massania, you have Tufts. So right there, it separates us, and it isolates you in a certain geographical way. But I think that when I'm in the residency selection committee, and it's like 12 of us, and it always surprises me that when we sit there and we all interview different people, and we sit in the room and we go to pick the people we like, we all like the same persons. That to me floors me every single time. We have glaucoma people, we have oculoplastics people, we have retina, we have cornea, and we all like the same. And we always look for somebody who's going to work well with each other, who's nice. You can be competitive, and you're going to be competitive because you made it to interview at Bascom, but you're not cutthroat. You're not going to be trying to get the cases away from your colleague. We're not at that level. We're at the level that we all want to work hard, do what's best for the patient, and do it in a happy, collegiate way. And I think Bascom really exemplifies that. I think that if you talk to, and the way you see it is at Academy every year, you go to alumni parties, everybody has the alumni party, and the Bascom Palmer party is full. It's so full that sometimes people can't get in because the space is so crowded. And you just love going back and seeing the people who train there. There's a camaraderie and a love for each other that I haven't seen anywhere else.
Yeah. So that's interesting. I mean, that's one of those places where I've obviously, from being, like you mentioned, you were a trainee as a fellow. Now you're an attending. You've been part of the selection committee. It must be, fun to see it from both sides, to where you get to play a role in training the next generation and picking people who you watch them grow throughout their careers. And we talk about the mentorship that you both touched on earlier as well. Dr. Albini, I know as co-director of the Vitreoretinal Surgery Fellowship, I know this is a difficult year for everything that's going on with everybody in terms of training and trying to find the right fit for who's going to be training at their institution. You, as an institute, as a director, and your fellowship program this year is not participating in the match. So, would you like to talk about that and what the difficulties and challenges of this year have been?
Yeah, I think that's been a difficult decision that Nina and I and others had to make. I think that I think we're going to be criticized for our decision by many folks, and we recognize that it's a loss for a lot of people who really wanted to at least take a strong look at Bascom Palmer, if not it being their top choice for fellowship training. So we don't want to treat that lightly. But it was a grave decision, really, coming from the fact that we thought that the Zoom experience for interviews was going to be somewhat challenging, and it was going to be somewhat difficult for many of us. And we didn't think that we'd get the same ability to see somebody in real life on a Zoom interview as you do when you meet somebody. Those of us that interview for fellowships and things, you realize that there's a big difference between the way somebody looks on a CV and on paper and what their personality is like. And it's actually extremely difficult to, I think, make a great judgment about somebody from a 10-minute interview or having 10-minute interviews with multiple people and then talking about it. But I think it would be even harder over Zoom. So that was part of the equation. The other part was that this year we happened to have two fantastic candidates that were internal, and for various reasons, the faculty felt strongly that these folks would be top candidates, and that it would wind up for a number of reasons being a little bit insincere to go through the interview process if we had very good reasons to take these internal candidates. And the combination of those two things is what led us to make that difficult decision. So, I mean, programs do this from time to time. We hope not to do it for a long time. But with all the uncertainty that's inherent in the COVID situation, we thought that was the better way to go. I don't know, Nina, do you have any other?
Well, I have to say that I still remember when I interviewed as a fellow, there was a group of us, that goes to the programs, and I remember going to a program that we were all interested in. We had to pick at the time whether you go to this one or that one because it was the same day, so you have to make a choice. And, we ended up all going to this one program, and when we get there, the word of mouth was that they already knew who they wanted. So here we are, we sacrificed one interview to go to this other interview, and these people already know, so why are we here? Why are we wasting our time? And, part of me said, no, this hearsay, this is not true, this is what fellows, residents are saying about the fellowship. And lo and behold, that program takes the person that everybody knew that was going to get there. So, I'm still jaded about that, and this is how many years later. So I told Tom that, I think that it would just not be fair to make people hopeful or thinking that they could do something when in reality, it's not going to happen. So, it was a very hard decision. I feel like, Tom, this is not something that we like to do. This is not something that we plan on doing. I think this is, we're in a worldwide pandemic that has changed our lives in many different ways, and I think this is the best decision for this year.
And I think that one thing about that also is that it's, we talked about purpose, earlier, and if I guess it's naive for me to say this, it's probably not my place to say this, but as a medical student, as I'm trying to get to the process of becoming an ophthalmologist first and foremost, I have an interest in retina, that's true, but I think you have to take one step at a time. It's what's the goal of why I'm doing this? Is it to be in the field or is it to be a certain place? And I think that's one thing to whoever's out there who's concerned. I guess I can't really give any solace to the fellows applicants, but I guess I can give it to the resident applicants out there. So we have, I guess, our responsibility is to take things in context here. So, this year's match is going to be very unpredictable. I don't think we really know where we're going to end up. And I think it's just going to be very interesting to see. But, I think it's important to keep in mind that purpose, why am I doing this? What's inspiring me is important to keep in mind. So
one more quick observation just about this is that, retina is a small field. And we don't all know each other, but a lot of us know each other. It's a pretty tight group of individuals. And one of the really great things about the interview process is that it's a way for the applicants to meet all the people whose papers they read and who make the decisions and who present new data and so forth. And also it's great for us to meet the people that are coming into our field. And so it's a big loss for us not to meet the people that are coming into retina this year, or some of them anyway. Again, something that we had to do this year. But it is, in general, the match process I think is fantastic. And going back to VBS, like Nina said, there was a group of folks that she was very friendly with when she was applying for fellowship. My year was the same thing, and it happened to be that small group of us that founded VBS that came out of that. It's I think it's a great way to get kind of inducted into your subspecialty.
Sure. And yeah, so this can be a, opportunity for people to take up those professional society meetings more regularly and still get engaged with the community. And there's going to be opportunities down the road to really make it count. So I think, again, always think positive, and we'll see what happens with that. And wishing you both best of luck with that process. Let's finish up here with something fun. Dr. Albini, I know that you're fluent in Croatian. Your family's Croatian by descent. So I want to know, how do I say uveitis in Croatian? Can you teach me how to say Croatian?
I think it's just uveitis. So I don't think there's, as far as I'm concerned, I don't think there's a real Croatian word for uveitis. I've never asked that. It's funny because in Croatia recently, Croatia broke away from Yugoslavia in 1992. And as part of that movement, there was a committee or a political movement that tried to clean up the language. Mm-hmm. So they tried to remove some of the terms that are in Croatian that are used. For example, aerodrome, which I think has a French origin, was the word that we used for a airport. Uh-huh. And so they tried to switch it to zračna luka, which is a air harbor. There's a word for luka, harbor, in Croatian that's been used for 1,000 years, but there was no airport word. So they made, the air harbor was the new word for airport. And so they had this movement of cleaning up the language. Medical terminology is impossible because it's all really internationally. You'll find that people use English terms everywhere. They read their English textbooks. And so I don't think there's a word for it, but I will say this: I have given a few lectures in Croatia, uh-huh. and even though I speak very rudimentary Croatian, all my schooling was in the United States. So, but it's very hard to get to with the technical terms, So I prefer to do it. I prefer to do it in English. It's not so easy to translate over, but you'll find internationally that most places use English terms.
Sure.
If you had to make it up, what would it sound like?
Yeah, what would it be? This is your chance. You create your own word now.
Inflamacija oči would be like ocular inflammation.
Oh, wow. Okay, so I'm not going to repeat that one. I'm going to...
Even that, inflamacija is upaljene. Upaljeno sounds more like base Croatian. That means inflamed, like a... so upaljene oči means inflamed eyes. There you go.
So I got one. As long as I got one word out of you, I'm like, all right, cool. Smart people on the street, so that's good. Dr. Berrocal, what about you? How about retinopathy prematurity in Spanish? Is that possible?
Retinopatía de la prematuridad.
Oh my gosh. No chance I would get that one right. Retinopatía.
Retinopatía
Patía
de la prematuridad.
de la prematuridad.
Muy bien.
Did I do it? Oh, awesome. Yes, my Spanish teacher from high school will be so proud of me now. I made it all throughout this process. Well, thank you so much, both of you, for joining me. This was such a fun opportunity and chance to talk with both of you. I learned so much, and to really pick your brains about, the wisdom of what you learned through your journey and what you can share with us and the rest of the audience means a lot. And, hopefully meet in person someday in a safer time. And I want to wish you both the best of luck with everything you're going to be doing this year with residency, fellowship, and wish you both safe and happy rest of the day and the week.
Thanks for taking your time to do this.
All right, appreciate it.
What's your ethnicity?
My parents are from Pakistan.
So can you say retinopathy of prematurity?
Oh, no. I can just tell you where the best place to find biryani would be, probably. I can offer. If you ever need that, I'm your guy. That's what I can definitely guarantee you.
Sounds more useful.
Yes.
Well, thank you so much. It was wonderful. Very nice meeting you, and thank you for having us.
Absolutely.